There is a lot to get into in the world of veteran affairs and benefits. Employee cuts announced by the Veterans Affairs Office are set to take effect on September the 30th. The VA says that nationwide reduction is part of a larger strategy to create more efficiencies, invest in more high-performing employees, and make necessary infrastructure improvements. Critics, though, are raising concerns about the continuity and the quality of care.
The Veterans Administration made a series of announcements this summer, changes to proposed staffing cuts, survivor benefits, and collective bargaining agreements with union employees. Here's a look by the numbers. 30,000 VA employees will be laid off instead of 80,000. The move is attributed to voluntary retirements. $800 million. That's how much the VA will invest in systems to modernize its infrastructure. It will expand automation to process claims for survivor benefits, and changes to its health and benefits mobile app will make it easier for veterans to file for mileage reimbursement when traveling to and from medical care. 2 physician referrals will no longer be required for care at non-VA medical centers. The changes, they say, are designed to increase veteran access to additional health care providers. The most talked about change involves union contracts. 400,000 VA employees saw their union contracts canceled. The VA announcement came after President Trump's executive order barring unions from automatically withholding union dues from employees' paychecks. That same order also excludes specific federal agencies from entering into collective bargaining agreements. The VA's police officers, firefighters, and security guards are exempt from that executive order. The union contracts of these 4,000-plus workers does remain unchanged. The VA has defended these changes as a move to modernize and increase efficiencies as well as focus on patients. On its website, it cites long-standing practices that are union-focused to the detriment of veterans.
And joining our discussion, our attorney and subject expert Samantha Gezelbash. She is the managing partner at Legal Lion Employment Law Firm. Also here is journalist Caitlin Farrell. She's a political reporter for the Tampa Bay Times and has been reporting on developments at the VA. And Galen Wheelis, president of the local 1594 Bay Pines VBA Regional Office. Thank you so much for joining us. Caitlin, I'd like to start with you. Tell us about what you found in your extensive reporting on the issue of veteran affairs changes.
Sure. So the most recent article I did that just came out earlier this week centered around a report that's released by the Department of Veterans Affairs itself, the Office of Inspector General. Every year they look at the number of positions within the VA system and the number of staffing shortages, so how many fewer employees are in those specific roles. This is a report that comes out every year, and it's been a long-standing issue as far as reporting severe staffing shortages, and that's the agency's word, in a number of direct care roles. And so the story that I did really looked at that report. It examined the extent to which we're seeing severe staffing shortages at the VAs at Bay Pines in Pinellas County and at James Haley VA in Hillsborough County, and highlighted some of those direct care roles and the confluence of those severe staffing shortages, the end of collective bargaining for many employees, and the way that those factors may compound to affect veterans.
One of the things that you looked at in your reporting was the wait times, specifically for mental health services. Explain that to our viewers.
Correct. So one thing that folks might be interested to know is that you can actually go onto the VA website. There's a dashboard, and you can see wait times for a variety of services across VAs in your region. One of the things that I was looking at specifically at the VA, really for the James Haley VA in Tampa, it's a quite large VA, is looking at wait times for individuals who are new patients looking to get mental health care. Mental health demand for mental health has increased dramatically over the last decade. And initially when I started reporting that, looking at the VA numbers, the wait times were in excess of 100 days for a new patient to come in and get an individual appointment. Now, I have since seen that number has decreased. It went up as I was reporting it, and then it has since in the last week decreased. And so I think it can vary quite wildly, but it's important to note, I think, that psychiatrists were one of the positions that had severe staffing shortages. And so that's one of the, important things to look at is wait times. I will say the VA has said that they have continued to improve wait times, and investing in infrastructure is a big part of that, they say. But you can kind of go and check the numbers yourself as well.
And Samantha, this is an issue that has a lot of people talking about what the roles of the unions are. From your perspective as an attorney, explain how not having a collective bargaining agreement impacts not just the staff, but maybe the community that is serviced by that staff.
Absolutely. So I think first and foremost, it can absolutely affect the morale of the employees, which obviously can affect the services being provided to the veterans and the public. On the VHA side, for example, when you have nurses, physicians, not feeling comfortable at work, feeling distracted about what might come next, knowing that they can't have a union rep if they're called into a meeting to explain, let's say, a report of contact that might not even involve something directly with them, just something they witnessed from a patient, it makes them nervous and uncomfortable. So you don't want employees that feel uncomfortable, like they can't speak frankly, and like they don't have support in the workplace. On the veterans benefit side, very similarly, there are a lot of performance standards that relate to quality and production and things of that nature, and it can be very complicated to sort of allow those employees to understand what they're supposed to be focusing on, and the union largely helped them to make sure they had clarity on that things were fair among all of the employees. And now, even though you have people like Galen still continuing to do their work they're doing, when management won't allow them into the meetings, won't acknowledge, their attempts to bargain and uphold a CBA that is technically still legal, and there's been no ruling on the legality of removing the collective bargaining, you have employees not feeling comfortable, not reporting things, and the quality of their work can suffer. And while I don't think we're seeing that immediately, that's something that moving forward in months and years may affect the quality of decisions that affect veterans and people in the public as far as the benefits decisions and appeals on those decisions, which is already a very lengthy process.
Galen, tell us about what you are seeing at Bay Pines.
I can definitely speak to the morale that's in the tanks. A part of our job is to interpret policy and law and regulation, and so when the agency appears to be ignoring policy and law, that is stressful. I mean, employees are asked to do it, the agency should too.
When you look at how the employees on the front lines are doing their work and the ability to report things that are concerning to them, or maybe there's an idea on doing something a different way, a better way, what is the mindset, what is the system that will be in place where they can bring that information to the forefront?
Well, I think that is a big concern for a lot of federal practitioners like myself, is that without the union present, I mean, again, they're present, but them being given the time, resources, and ability to actually engage, it eliminates a lot of the place that they used to have to, vocalize those concerns or protections they have if they did vocalize and then face some sort of retaliation, frankly. Along those lines, other venues where employees could take these concerns are sort of being neutered, for lack of a better word. They don't have a lot of effect. They're being broken down at the same time. And so when you have employees that can't vocalize if there's patient safety complaints possibly, other illegal actions going on, you have an employee workforce that is not going to bring issues to light that are transparent, that affects taxpayers, that affects the services, going to veterans in the community. And there really is not a place for that now,
You've said that you have some cases that you're looking at where the focus has been on productivity and meeting a certain number. Can you share a little bit more with that? And then I'd love for Galen to chime in on that.
Yes, and I think one specific example I gave was that there is a policy at one of the local VAs here recently that was implemented for how employees get holiday leave. It used to be based on seniority, and the union obviously helped to ensure that that was facilitated fairly and properly. And as of recent weeks, that has been changed to the employees who get the best production rather than quality or seniority are now going to get first dibs on holiday leave. And you can see where, of course, we want productivity, but we've always had productivity from federal employees. That's really not an issue in the way that, you know, some people in the administration have said that it is. But it incentivizes employees to focus on numbers and going through cases quickly. And while we hope everybody does a good job, that, you know, humans are incentivized to get their time off for their families and themselves too. So you don't want the focus to be on productivity. When you remove the union from being able to effectively bargain over that, it can create, obviously, backlash in the kinds of services and decisions that are then coming out that the veterans rely upon.
Caitlin, how difficult is it for the folks who are involved in this to speak out about the things that they like or that they don't like about this? It's almost like a wall of silence.
And this year they removed something they do generally every year, the all-employee survey, which is you know, a mechanism for management to hear from employees. They've also removed, at least at our regional office, a comment box for our director's comment box. And so, yeah, it's difficult to get. It's difficult to know how to ask for any accountability, right? With the VA no longer honoring the contract, for example, I can speak to myself. I've used the VA's. They have their own procedures for grievances and things if we notice a mistake, and the agency's been ignoring their own procedures. So we're left very frustrated and stymied and not knowing how do we bring up very valid concerns. These are some honest, good-hearted questions that just are being ignored.
Caitlin, how difficult has it been for you to get information? You talked about looking at the website, you talked about going over the report with data, but what about talking to people who are in the front lines working?
Yeah, I can concur that it's difficult. I think that overall, you know, kind of what you've described has contributed to really a chilled climate overall. And I understand, you know, taking a step to talk to a reporter is kind of a different ball of wax. And sometimes that's often, you know, it's like someone will say, I've tried everything and nothing has worked, and so now I am talking to you, the reporter. So I understand the reticence around that, but I think, you know, I want to let people know that it's hard to shine a light on what's going on, you know, when people won't talk, but that I'm in the process of trying to connect with veteran groups in the community, and always happy to talk off the record or on background. And I think it seems to me that people have a real sense that that retribution or retaliation, if their name is in the paper, can be a real thing. And even retirees who are getting benefits, I sense that and I've heard that. And so yeah, it's definitely a struggle.
Thank you so much for adding your perspectives. We always try to bring different voices to the table and just amplify different voices so that the residents at home, the viewers at home, can decide for themselves and get informed before they make any decisions. So thank you so much for helping us do that.